Dear Regional Director, dear Ministers, ladies and gentlemen, I highly welcome this important conference organized by the World Health Organization on the economy of well-being. Though I regret not being able to join you in person, I'm honored I can address you through this virtual platform. Besides welcoming this conference on the economy of well-being, I also want to welcome explicitly the concept of the economy of well-being. This concept is an interesting starting point for dialogue among ministers from diverse, also politically diverse backgrounds. Today's presence of ministers from various backgrounds, such as economy, finance, social affairs, foreign affairs, and health, proves the potential of this concept. As Belgium is currently chairing the Council of the European Union, we take this moment also as an opportunity to foster dialogue and collaboration between health and many other ministers, with the ambition to promote an economy of well-being in the back of our mind. Please allow me to give you some examples. Recently, in March, the Belgian Minister of Finance, the Minister of Economic Affairs and Employment, and I convened a ministerial jumbo meeting where all finance and social and employment affairs ministers from the EU met. On this occasion, we discussed the positive impacts of social investments and social reform on economic growth, on productivity and fiscal sustainability. Allow me to signal another initiative, our conference on mental health in the workplace, organized by the Belgian Federal Minister of Employment in January. The key takeaway message for me, and one that resonates deeply with the economy of well-being, is that we, as policymakers, should focus more on improving the quality of jobs, also from a health perspective, rather than merely aiming to increase the number of jobs, which has been our mantra for many years. This focus on quality will ultimately also lead to increased labor participation in general. I refer to the importance of primary prevention in this area, such as the right to disconnect, the value of social dialogue, which is instrumental in nurturing a healthier and more democratic work environment, but there is also secondary prevention. The medical principle, do no harm, should apply in the workplace and in the economy as a whole. As a third example, I would like to turn to R&D in pharmaceutical research. Belgium will host a conference on the 17th and the 18th of April, focusing on unmet medical, individual and societal needs. In this conference, we will focus on objective methodologies to assess these unmet needs with the aim of directing investment towards addressing priorities, mainly through research and development. However, we must also mark our boundaries. While we endeavor to channel investments toward initiatives that improve health, we must acknowledge occasions where such a win-win scenario does not exist, and therefore commend the WHO's ongoing work on elucidating the commercial determinants of health, a crucial step towards safeguarding public health interests as the prime consideration. And I look forward to the report that WHO Europe is developing on this topic. Let me finally add one more thought. We should not forget that above all, peace is the most important ingredient for any society to prosper. I'm confident that your deliberations at this conference will pave the way for transformative action towards healthier, more equitable societies. I wish you a productive and an inspiring conference. Many thanks.